stroke team? It is. Yes. Yes. Team, we have a thrombolysis call that's just come in. It's a 33-year-old lady who's had speech disturbance and started at 10:30. So she's in thrombolysis window, and she's due to arrive in 10 minutes. She doesn't have any COVID symptoms and her blood pressure is normal. So I'm just going to put out an emergency thrombolysis call, please.
We'll get ready.
Hi, this is to activate a thrombolysis call, ETA in 10 minutes, to the NMCCC Chandler Wing. Thank you.
Hello.
Is this
Hi.
a call?
Yes, first positive. Normal independent at 10:30 speech disturbances.
Okay. What's her name?
Ashley.
Ashley. Ashley, hi Ashley. I'm Ellen, I'm one of the stroke doctors.
Yeah,
Can you just lift your arms up for me?
yeah.
Very good, very good. And just bring them down. And can you look over here? And over here? Can you tell me your name? That's okay. That's okay.
Yeah,
That's all right. Can you feel me touching you on both sides?
yeah, yeah.
Okay. Okay, so she's a fast positive for 2 points for language. She'll probably be a thrombolysis case.
Okay. Any COVID symptoms?
No COVID symptoms.
So no recent travel, no cough,
No.
and no spike in temperatures.
No spike.
Okay, brilliant. Can we go inside? Thank you.
Team are coming through. There are no COVID symptoms of this lady.
Yes.
Ashley, we're just going to get you over onto this bed just here, okay? And we need to do a few bits. So if you, do you mind helping her up?
Yeah, we can
Yeah.
transfer it to this trolley. You're going to be in good hands. Yeah, okay, if you can just stand up, please.
I think that's the most.
Okay.
All right, Ashley, if you can sit down here for me, and we'll pop your legs up if that's okay. Brilliant.
So can we get a hand over, please?
Yes, indeed. This is Ashley. She is 57 years old. She was in the classroom today. When she was trying to write on the blackboard, she wasn't able to write the sentence. She was mixing up all the words in the blackboard, and her colleague have noticed that she was having this problem. And when she tried to speak, she wasn't able to speak. She was mixing up the words. Normally she's fit and well, she has no problems. From the time we picked her up, she's been the same consistently and she continues to be quite dysphasic. My colleague will give you the handover of the observations and I'm going to book her in now.
Thank you.
So en route, her blood pressure was 130/72, temperature was 36.7. Pupils were 3 reactive, both of them, and GCS was 13 out of 15, E4, V3, M6. VM was 4.8.
Hello. Hi, here she's been booked already.
Thank you very much. So just as a recap, so she's 33 and the time of onset was at 10:30.
Indeed, it was 10:30, 10:30. Yes.
And it was difficulty writing and speech abnormality as
Indeed,
well.
yes.
Okay.
Normally fit and well.
So no past medical history?
No post-medical history.
Does she take any medication?
She doesn't.
Is she allergic to anything?
Penicillin, indeed.
Penicillin?
Yes.
All right. So I'm just going to hand over to the rest of my team. Thank you very much for the information.
Thank you, cheers. Actually, okay, we wish you all the best. Good luck. Take care. Cheers.
Bye. So we have time of onset at 10:30, speech abnormality and difficulty in writing. Can we just get some up-to-date observations and request some bloods?
Yeah.
And I'm going to speak to my consultant.
Okay. Juaria, I'm just going to do a full set of observations. I'll call them out to you if you can fill in the stroke narration for me, and I'll get the bloods and everything.
Ashley, hello. My name's Eleanor. I'm one of the stroke registrars.
Yeah.
Are you okay?
Yeah.
Ashley, can you close your eyes for me? Very good. Open them up. And can you lift this arm up for me? Good. Very good. Very good. Can you tell me your name?
Yeah. It's
Ashley, how many fingers can you see?
Oh
Okay.
gosh. 2.
Okay.
Oh god. Oh. Ow.
Sorry, it's going to get a bit tight.
Oh.
Just focus on the doctor, okay?
Yeah.
Don't
Ow.
worry.
Ashley, can you look at my finger?
Yeah.
Can you see here? Well done. Look up. Look down.
Yeah. Ow. Oh.
Can you show me your
Oh.
teeth? Show me your teeth. Well done. Well done. And can you raise your eyebrows? Can you raise your eyebrows?
Just
Yeah.
your temperature, okay? Sorry.
Oh god. Oh.
So normal.
Ashley,
Yeah. Is that help?
can you say tip top?
Fork.
Can you say 50-50?
Yeah. Yeah.
Okay.
Yeah.
Alright, well done, thank you.
Let's
Oh
lift
my
your
God.
arms up.
Yeah.
Can you lift this arm up?
Yeah.
And this one?
Yeah.
Close your eyes. Hold it there. Hold it there. Well done.
Oh my.
Good. Good. Well done.
I'm just going to do the cannula.
Yeah.
I just need to put a cannula in, okay, my dear?
Hi.
It's going to be a sharp scratch.
Home. Yeah.
Pull me towards you. Pull me. Can you pull me?
Yeah.
Good. Good. Let's have a look at your legs.
Yeah. Okay.
Can you bring this leg up? Well done. Good. And this one. Bring it up. Very good.
Yeah.
Can you feel me touching you on both sides?
Yeah. 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 Yeah.
Can you bring this leg up again? And push up. Push up.
Yeah.
Good. And now this one. Push up. Strong.
Yeah.
Good.
Home. Home. Just can I?
We'll try and get you home.
Ow.
Well
What? Ow.
done. Sorry, I know.
Yeah.
Just going to
just
take some
gonna-
bloods.
I'm going to check your reflexes, okay?
Oh. Yeah. Oh.
We're nearly there.
Pen. Pen. Home.
Home.
Yeah. Oh. Yeah.
Are you in any pain? Are you in any pain? No,
no.
pain.
No.
Okay. All right. How are you getting on?
Yep, nearly done.
Oh. Oh.
I'm just going to
Well
stretch.
done. Here, I'm just going to do a BBG if you can print me out a label.
Yeah.
So actually, we're going to send off some blood, and we're going to do a scan of the brain.
Yeah. Yeah. And then yeah.
So
You
Ashley,
just stay there for us.
when we finish this, I'll let you know what the results are. Okay?
Oh.
It's okay. It's okay. How are you getting on?
Yep.
Have we got some recent odds?
Yeah,
as well?
so blood pressure 122/68. Heart rate's been 61 and looks to be in normal sinus rhythm, but we'll get an ECG after the CT.
Good.
And saturations were at 98 on room air. Temperature's 37.3. And if you can run the BBG for me to area, that'd be brilliant.
Ashley, I'm just going to listen to your heart.
Yeah. Yeah.
Thank you.
Yeah.
Thank you.
Yeah.
Well done.
Okay. Team, so we have a 33-year-old with a sudden onset of speech abnormality at 10:30. So she is within window. I think she's a thrombolysis case. So I'm going to speak to my consultant. Ivan, do you mind just calling the CT scanner?
Yeah.
And do we have any bloods at all? Great, thank you. So creatinine is normal. Thank you for that.
Hi, it's Ivan calling from ESU. I hope you got the bleep with the thrombolysis call earlier. Okay, we're ready to come down if you are. Brilliant. Would you mind requesting urgent Porsches, please? Thank you. All right, see you in a minute. Bye. CT ready.
Hello, Dr. Sinister. Hi, it's Eleanor. It's the stroke registrar calling from ESU. We have a potential thrombolysis case. She's a 33-year-old who had sudden onset speech disturbance starting at 10:30. We're just going to take her off to the CT scan. I'll let you know when the results are in. Thanks.
Oh.
Hello.
We're just in the CT room now, okay, Ashley? There's one of the radiographers. I'm going to want to go through a few questions with you. But we'll get over onto the CT scanner at first, okay? We'll just
Yeah.
pop the brakes on. Alright, put your feet up. Lovely. So that's really good.
Yeah, this
Okay.
is here on the and just lean back to the head.
Lovely. Soften up your bottom over. That's it, lovely. So she's come in with expressive dysphasia. So she may not be able to answer all the questions, but she is allergic to penicillin. All right.
So just going to raise the leg of the fixation on the
Hi, it's the stroke registrar. Is this the neuroradiologist? Hi, we've got a 32-year-old lady who's come in with sudden onset speech disturbance. She's just having her CT scan now. Can we get her reported, please? Thank you.
Thanks, Eleanor. I've come straight down actually because I was only upstairs, and on the way I went via neuroradiology. Ashley looks to me like she's got an M2 occlusion, and Pete thought so downstairs as well. Her aspects is good. So can you just go through her case for me again, see whether we can thrombolyse?
So she's a 33-year-old lady with no past medical history other than a penicillin allergy.
Yep.
And today at 10:30, she noticed that she was having difficulty in writing, and her colleague noticed that she had a speech abnormality.
And she's dysphasic on exam.
She's-
Does she have any other abnormality when you see her?
No, but we think that she has some new right-sided weakness.
In which case I'll have another quick look and just make sure. Contraindications, is there anything that you know of in terms of her past history?
No.
And we've gone through that despite her language, no con. And what about her blood pressure at the moment?
Her blood pressure was normal, it's 122 systolic.
Any anticoagulants that she's taking at the moment?
She's on no regular medication.
So look, we don't want to waste any time. We've got 2 hours since onset, a stroke syndrome, no contraindications, blood pressure's okay, not on medicines that would cause her to bleed. Is there anything you see would be a problem if we went ahead?
Not in this case.
What would you do if we left it to you? Would you treat?
I would treat this
Okay.
lady.
So let's go straight for that. I'm going to ask the nurses if that's all right to draw up the medication. I'll just check out the NIHSS now so that we've got a formal documentation of where she is just before we get going. Thanks very much, that was very clear. Thank you. Hi Ashley, my name's Dr. Sinister. Anna has told me all about you. I'm just going to have a quick check of you, if that's all right.
Yeah.
Thank you very much. So we've already discussed the case. I'm just going to double check the findings. What did you find when you examined 20 minutes ago?
So when Ashley came in, the main neurological findings was that she was having expressive dysphasia, so she was unable to repeat or name objects, but
Okay.
I couldn't find anything else on her upper or lower
And
limb.
she seems to be similar to how you first examined her.
From after the scan, yes, although I think that she might be having some new right arm weakness.
Okay. So what we're going to do, Ashley, I'm going to quickly check you over. At the moment, we've discussed the scan and we think that we are going to go ahead. And I'm going to ask the nursing team over in the behind me to prepare the infusion, just so that we're ready. I don't want this to slow things down. Ashley, can you tell me your name?
Um.
I see that's
Yeah.
difficult. I
Yeah.
see that's difficult. I'll try another one. Can you tell me how old you are? That's hard as well. Maybe
Yeah.
you can understand me a bit better. Can you raise your left arm for me?
Yeah.
Brilliant. Can you touch your nose with your left hand for me?
Yeah.
Oh, that's spot on. So I think you're understanding me a bit. It's difficult to get words out. I've got some, do you have some standard pictures? Just to repeat that, can you see what that is?
Yeah. Yeah.
Yeah. Can you try and say what it is?
Fork.
What about that one?
Yeah. Fork. Yeah.
Yeah. Okay. And I wonder if you could just repeat a couple of things for me. Can you say mama?
No.
It's difficult, isn't it?
Yeah.
And say tip top for me. Tip top.
Free. Yeah.
That's fine. Thank you very much. Let's just try to see how the rest of things are going. I'm just going to block off this right eye for you.
Okay.
Keep looking at my nose. I know you can understand me a bit, so just follow my hand whenever you see it. Brilliant. Look at my nose. Follow my hand whenever you see it. Brilliant. Keep looking at my nose. My hand when you see it. Keep looking at my nose. Hand. Perfect. Try the other eye. How many do you see? Can you see my hand?
Yeah.
Keep looking at my nose. Look at the hand when you see it.
Yeah.
Look at my nose. Hand when you see it. Perfect. Hand when you see it. Hand when you see it. Perfect. Now look at my nose and look to see wherever the hands appear. Brilliant. Look at my nose. Look to see wherever the hands appear. All right. Raise your eyebrows quickly for me. Close your eyes tight. Give me a big grin and show me your teeth. Fantastic. Keep looking at my nose. I'm just to turn your head from side to side. Perfect. Put the arms up like this for me. I'm just going to slip this off for 1 second. I want you to turn the arms around and close your eyes. Close your eyes. And I see what you mean. There is a little bit of drift there, isn't there? Open the eyes, Ashley. Can you put the hands out strong for me? Keep this one up, right up and strong. Right up and strong. Now, this one right up and strong, and I'm just getting some give there and some give there. Arms like this for me. Pull me towards you on this right one and on the left one. It's a bit stronger on the right, isn't it? Let's just have a look on the legs. Let's quickly just lift this leg right up for me. Hold it up. 5, 4, 3, 2, 1, and relax. Lift this one up for me. 5, 4, 3, 2, 1, and relax. Looking at me. Tell me when you see, look to the side that I'm touching you on. Very good. Look at me, side I'm touching you on. Very good. Look at the side or sides I'm touching you on. Brilliant. Look at me, side I'm touching you on. Look at me, side I'm touching you on. Look at me, side or sides I'm touching you on. Very good. With this finger, touch your nose. Touch my finger. And your nose. And my finger. Very good. With this finger, touch your nose, touch my finger, touch your nose, touch my finger. That's really good. So, thank you very much for doing that, Ashley. And that looks a bit similar to what you saw before.
Slightly worse.
Slightly worse. Ashley, we've looked at your scans. Ellen has told me all your story, and I've examined you myself.
Yeah.
And we are going to have to give you this clot-busting medicine. Now, I don't think we have anybody here with Ashley, do we? And we haven't been able to get anybody to speak to let them know that this is happening. But we have your medical records on our system, and we know that this is a reasonable thing to do. What we are going to do is give you some clot busting medicine. I'm going to ask Eleanor to read out our standard information about the clot busting medicine, and she's just going to do that now.
So Ashley, we usually give the clot busting medication within 4.5 hours of the symptom onset. So with you, because your symptoms started at 10:30, we're just 2 hours in, so we can give you the medication. So with the clot busting medication, we expect about half of patients to recover with little or no disability. And if we don't treat you with this medication, we expect about a third. About 1 in 50 patients might have a serious harm, which includes something like internal bleeding in the brain or in the tummy, but this is quite rare. And as a routine, we give treatments that we give to over 150 patients per year. And we think, given your past medical history and your symptoms, that you would benefit from this medication.
Yeah.
Ashley, I'm just going to follow that on. We've looked at your case carefully. We see that you would be suitable for the treatment. We give it all the time. There are some small risks, but there is a chance that it will take this disturbance of your speech away.
Yeah.
It is not easy for you to understand exactly the complexities of this, but in what you've heard so far, are you assenting to let us go ahead?
Yeah. Yeah.
And it's difficult, but in Ashley's best interests, we have done our best to explain what's going on. We have looked carefully, and we should give the clot busting medicine, please. Nurses, thanks.
Okay, so we're all go for thrombolysis.
Yes.
Consultant said yes, and patients consented or in best interest, correct?
Yes.
Brilliant. So we're going to give Actylase.
Yes.
And based on weight, we're giving a 7 and a 65. Is that correct?
That's correct.
Brilliant.
Yes.
Okay.
So I'm just going to
I'll start drawing it up. Okay, so I'll show you 7 mils.
Yep.
Okay. Ashley,
Yeah.
I'm going to give you that drug they were speaking about, okay?
Yeah.
This is the thrombolysis medication. They've already gone through the consent with you. So you're going to have this bolus, and then you're going to have an infusion of the same drug over the course of an hour. All right, we'll be keeping a very close eye on you
Yeah.
with all the blood pressures. All right?
Oh, yeah.
And what's the time?
Time is 12:35.
Okay, and blood pressure you're happy with?
Yeah.
125 over 57.
Yes, go
Okay.
ahead.
Oh, yeah.
All right. Okay, Ashley, I'm going to go prepare the infusion now, okay? Hey, Maria. So we've just thrombolyzed that lady, so now we're going to continue on with the thrombolysis protocol. So 15-minute blood pressures for 2 hours, and then we're going to do half an hourly blood pressures for 4 hours, and then hourly blood pressures for the remainder of the 24-hour period. The doctor should be ordering the repeat scan for tomorrow, but I'd like you to keep a close eye on her, just because she's young and she's been thrombolyzed. So neuro-obs are a must, and with all the other obs. Okay.
Thank you.
I'm gonna just check if the SHO Alpha can call the GP, just see if we can get any records and if we can get in contact with the next of kin. All right. Thank you.
Okay, thanks guys, that was great work here. So I was thinking we could do a quick debrief about what's just happened. We've got all representations here, we've got nurses, we've got consultant, and we've got registrar. So do you just want to tell me what went on, how it went, and anything we think we could improve on? Starting with nursing, please.
Yeah, so we met the patient out in the ambulance bay.
Yeah.
Reg did fast assessment, COVID negative from what they've been telling us. We've brought them in. We've done a full assessment by the Reg on the trolley, got down to CT. They've discussed it with neuroradiologists. When we came back upstairs, she was for thrombolysis. Blood pressure was within target, discussed it Reg as well at the time. We were given the go-ahead to go for the thrombolysis, so we did so, and it was within about 25 minutes.
Very good. Elena?
So we have a 33-year-old lady who came in 2 hours of sudden onset speech abnormality and very slight right arm weakness. She had nothing as far as past medical history and has a penicillin allergy. We did a CT head scan which did not show a clot, and she was within window for thrombolysis. There were no contraindications and her blood pressure was in range. So we went ahead with this.
Very good. And was there any delays on your pathway?
No, not at all.
So no, that's really good. Consultant Dr. Simister, did you find any issues in the
so
pathway?
you were very clear in terms of the case and contraindications and COVID status and blood pressure. I found that really helpful. I had some trouble with connectivity. I couldn't see the scan, and that's why I came down. But I was able to go via radiology at the time, and that allowed me to have a look at the scan and convince myself. It was good that you pointed out that she'd changed slightly, so we had a chance to look at that, document the NIHS beforehand. So from my point of view, I don't see that there could have been anything that we'd have done much differently. The communication I thought was really good today.
Thank you. Joera, anything to add at the moment? Is the patient stable? Anything you're worried about?
It's stable at the moment. I don't have anything else to add on.
Okay. Well, thank you. Well done, team.
Thank you.
Thank you.
Good work.